The Center for Simulation-Based Learning is an innovative educational facility at McMaster University, where students from the Faculty of Health Sciences come to learn clinical skills. As of August 2014, there are now 2 CSBL locations. This expansion has allowed for improved service and access for all educational programs within the Faculty of Health Sciences at McMaster University, both undergraduate and graduate.
The Center for Simulation-Based Learning, also known as the CSBL, had its first location in the Health Sciences Center, Room 1M. Due to the growth and expansion of the programs within educational services, there was a great need to expand the available space for clinical skills teaching and training. In August 2014, we welcomed new students to our brand new clinical teaching space in 1G for the first time. There's over 6,000 square feet of clinical teaching space. In less than a year, we've already recorded 13,000 student visits to the 1G area, including both students visiting for the first time and returning to practice.
While technological innovations are available in both centers, a very important aspect beyond technology is the fact that the CSBL provides a safe and comfortable environment for students to practice their clinical skills.
Beyond all of the teaching techniques, practice is a fundamental part of the learning process. The CSBL supports student events such as interest group, where students are able to safely practice many skills. For instance, oxygen therapy, lumbar puncture, intravenous therapy, physical exam, and history taking. They can do this through partial task trainer, simulators, and standardized patient. Put more clearly, hands-on is the best way to glean real-life experience.
Continuing with innovation as a driving force, one of the technological advances at CSBL 1G is the CAE Learning Space System. This system was acquired because of its video capabilities as well as its teaching features. The CAE cameras allow for live viewing and recording of teaching sessions, providing a level of flexibility. Additional features of the Learning Space System, which have proven invaluable, include evaluation modules for instructors as well as a feedback platform for students.
I have seen many students who are nervous when taking a patient's pulse for the first time. The comfortable environment provided by the CSBL allows students to practice their clinical and communication skills with standardized patients before interacting with real patients. The critique received is invaluable to the educational process.
The setup of the clinical teaching rooms follows that of real-life hospitals and health clinics. Initiatives like the nursing peer tutors assist students in becoming familiar with the healthcare equipment before they graduate.
Peer tutors are senior nursing students who are hired to support other nursing students with clinical skills, science courses, and sometimes just to offer support or discuss other issues. The CSBL 1G supports the peer tutor program by making a clinical teaching room available for this purpose. The clinical teaching room can accommodate between 10 to 12 students each. All rooms are equipped with vital signs equipment, hospital beds, and other equipment needed for nursing students to practice clinical skills.
It's one thing to train within a clinical atmosphere, but healthcare needs to translate into the real world. This is where the CSBL 1G Assisted Living Space is instrumental in educating students in transitioning a patient from a hospital to a home. This assisted living space is modeled after a real home, complete with a kitchen, living room, and bathroom, which includes a wheel-in shower as well as other amenities. But there's more.
The room setup is helpful in recreating problem-based learning scenarios with a focus on senior care and end-of-life care in the home. Students learn about safety in the home setting and working with patients who have cognitive and physical limitations. The 1G Assisted Living Space is helpful for teaching students safety or mobility issues, such as how to help a patient move around the home with crutches or how to use washroom facilities safely. Furthermore, the 1G Assisted Living Space has the teaching potential for other programs such as allied health, social work, child life programs, and interprofessional simulations.
Why is it important for students to learn in a simulated environment? The answer is clear. It provides confidence in real-life situations, and that confidence remains with the students as they embark on their careers.
My name is Oluwademilade Atilade, and I'm a student in the School of Nursing program at McMaster University.
My name is Molly Whalen Brown, and I'm an undergraduate medical student in the class of 2016 at McMaster University.
Simulation-based learning has exposed me to various scenarios I would use in my everyday practice as a nurse. It has also helped to improve both my clinical and interpersonal skills.
Overall, I found this has helped increase my confidence in that I feel more prepared for some of the difficult situations you can encounter on the wards.
Interacting with standardized patients has helped me to better notice both verbal and non-verbal cues amongst patients.
I also think a simulated learning environment is a great place to learn some of the less common procedures or skills that probably won't be seen during clinical rotations, but that are core pieces of medical knowledge.
The benefits are definitely endless, and this is one way of learning that has influenced the way I practice as a nurse.
Due to the unique infrastructure available at 1G, many visitors from other Canadian and international universities have toured the clinical simulation centers at McMaster University to learn more about using simulation as a teaching and learning tool.
While instructors and students come to teach and learn, behind the scenes, there's a dedicated team of staff who will help in any way they can to support students in their educational journey pursuing a health professions degree.
The CSBL 1G is a go-to lab, and nursing students find this as an excellent and supportive resource.
The CSBL 1G is a well-equipped facility which is easy to book, and most importantly, it provides a safe environment for students to practice.
The CSBL 1G area provides a wonderful opportunity for students to learn about patient care before they transition to real practice settings.
The CSBL is home away from home for me. The staff is wonderful and willing to help, and I have begun to appreciate this method of learning tremendously.
For me, the Center for Simulation-Based Learning is a safe learning environment to get feedback on skills in a supportive and constructive way.